Well, right before surgery, you want to make sure he's ready to go in. One of those things that we want to review is that he's done a surgical wash. We want to make sure that they understand the infection control aspects so that we can mitigate or lower his potential for infection. There's also the risk that we want to make sure his lungs are open up, so we review that he's going to be using a spirometer and the importance of that. We also talk about that he's going to be getting some sort of way of thinning his blood. And so there's a variety of ways that the surgeon can choose, so we review that. We also talk about TED stockings that he's going to use. We could also talk about as far as ankle pumps and certain circulation exercises that are important for him to do.
So that's the immediate pre-op. So do these make a difference, all these, like the surgical wash, does that reduce infection rates? How much by?
It definitely reduces rates. There are some studies that show some institutions have decreased their infection rate almost by half. You know, where you're dealing with maybe a surgical center or a hospital that will say have an infection rate of 5%, and they cut it down to 2.5%. I think that's phenomenal. It's certainly one of the things to look for because it's a disaster to have an infection in a joint replacement.
Right, because when we've got a implant like this that gets infected, it's
typically has to be removed. And then you're looking at a patient that will have what's called a cement spacer put in that has antibiotics in it. And then it's usually a minimum of 6 to 8 weeks to be able to come back in and put a new knee in. So it's not a fun process for the surgeon or, more importantly, the patient.
So that surgical wash helps, and then the spirometry, presumably the anaesthetist is pretty happy when his patient comes in with his lungs in good shape.
Oh, definitely.
Yeah. And it saves the physical therapist afterwards trying to clear a chesty patient too.
Absolutely.
So how many patients have you put through prehab now?
In this particular program, we've done about 120.
And what are the outcomes looking like? Does it look like something that's definitely worth investing in?
Oh, no question. It's been wonderful. Actually, of the 120, we've only had one individual go back into the hospital in the first 30 days. If you were to look at those statistics, those are awesome. Personally, they're probably unsustainable because they're so good, but it's awesome that we've had 120 people go through it and only one person has gone back in. And they only stayed in for a very short period of time and then came back out.
So that reflects really well on your surgical management, doesn't it?
It certainly helps. I wish I could say that all 120 were my patients. I think a lot of them are, but definitely it helps. I mean, getting people up quicker, using some of the things John had mentioned, the TED hose, I think is key to help prevent these post-op complications.
So why hasn't this happened before? You know, this is a relatively new project. Yet we've been doing joint replacements for decades.
True.
What's driving it now? What's happened? What's changed?
Lots of different things. I mean, patients want instant gratification. They want to get up, get moving quicker. We're doing joint replacements in younger and younger patients these days.
Well, that's not so good.
Correct, but it's the demands. The baby boomers are coming in. I mean, there were almost 700,000 knee replacements alone, 700,000 knee replacements performed in the United States last year. That number is only going to increase. And you know, the stresses on the healthcare system in general, outcomes are being measured very closely and scrutinized in this country. And all of this plays into that. So we need to have good outcomes. And that's how surgeons are going to be graded, how hospitals are going to be graded, and more importantly, have good outcomes so patients have, hopefully, you know, improved quality of life and, you know, do not have these disastrous complications after surgery.
That you put one implant in and it stays there, it doesn't get infected. And
that's the idea.
And you're back on your feet. Wow.
I think as